Okay, guys, I'm back here with another one. Now, as we see what's going on here, guys, so Jamaica has this map, this tracker that supposedly track COVID-19 infections, deaths, and whatever across the country. I just want to quickly point out a number of things here to you. You have to pay attention, Jamaica, to what's going on. Now, pay attention to this company right here, Amber Innovations. I don't know if the government of Jamaica issued some tenders for bids or whatnot to develop this thing. So pay attention to this company right here. Anything and anyone who is attached to this COVID-19 agenda, Jamaica, you have to pay attention. Now, apparently, since tracking had begun, I don't know what this is. I don't know if it's for the day or whatever it is. They're showing 921 recovered. Okay, so it's just updated September 4th. Right? Now, pay attention here. They're showing confirmed. Right? Recovered. So are they saying here that people who are sick, once you get it, you're sick? What happened to the, what do they call it? People who don't have any symptoms. What happened to those people? What does confirmed mean? What does recovered mean? How many people were sick? And deaths. Now, we go down here. Pay attention to how they're getting their data, guys. Pay attention to this. Google and those social media sites are spying on you. If you have your location turned on, the Google is using this information to send to various governments. The world government that runs the world runs it through Google and those social media sites, and they're spying on you. If you click on this Google Mobility Analytics, if you click on it, it shows you here. This is for, I think this is for Jamaica. Yeah, this is for Jamaica here. It's showing that retail and recreation is down 53%. Grocery and pharmacy down 36%. Down parks down 50%. Workplaces down 30%. And residences are up 12%. So the government of Jamaica is using this information that Google is creating to help these various governments better lock their citizens down. So if you notice that everything is down, so that means the government is going to be going after, the government of Jamaica is going to be going after people now who are in their houses, because more people are now spending more time in their houses. So that is why you see the World Health Organization pushing, community spread. That's where the community spread is going on, because people are now in their houses and so on and so forth. Pay attention to this Google. Pay attention to these cell phones that you have in your pockets. They are the long arm of the government, tracking and watching you and discovering your movements. If you click on Google Mobility right here, this one, if you go to the dashboard, the Google Mobility dashboard right here, you see, it takes you back to the Ministry of Health's website. So the Ministry of Health, I believe, is reporting information to Google, and then Google is providing it to the world government, because Google is a part of the world government, guys. Pay attention to those cell phones that you have in your pockets, all right? Okay. So, if I didn't say it, let me say it again. The pandemic
COVID-19 related symptoms, use the self-reporting functionality in the app to inform local health authorities and book an appointment to be tested. There are many Jamaicans stranded overseas who would wish to return home.
Don't get tested if you don't have to get tested. Do not get tested. Like, I wanted to go to Jamaica, over the summer, and I'm like, hell no, I'm not taking no test, right? So do not get tested. Do not let them trick you. You don't know what they're putting into your nasal cavity. You don't know what this made in China stuff is going to do to you. You do not know. Do not get tested. Do the opposite of whatever the governments are telling you. If they're telling you to wash your hand, wash your hand, wash your hands, guys, behave the way you have normally behaved. If you have taken a shit, wash your hand after you've taken a shit, right? Do the right thing. Don't be washing your hand, and all of that stuff. Mask up, mask up. Don't be a fool, guys. Don't be a fool. Don't let them trick you. The government is not your friend. Okay? All right. Now, so let's go over here. So here they ask you to report yourself. So you can report yourself right here. They're using this Google mobility stuff. Once you report yourself, Google obtains this information. Okay? This is not a joke, guys. This is not a joke. This is a world government right here. Now, let's go back a little bit and take a look at some stuff here, guys. So in Jamaica, in July, Jamaica recorded 10 deaths in one day. At one point, they recorded 10 murders in 24 hours. Where is the lockdown for that? Where is the murder rate tracker for murders, rapes, baby kidnappings, abortions, and all of that stuff in Jamaica and across the world? Where is the tracker for that? Do you know how many millions of babies were aborted last year, supported by the world governments? Let's take a look. I didn't look into that. How many abortions occurred in 2020? Let's put 2020. How many abortions? So Google is not telling you that. You have to look it up. Let's look up abortions in America. Look at this. Number of induced abortions in developing regions where there is no contraceptive care in 2016. Look at this, guys. 248 million abortions. This is across the world. In America, 623,000 abortions occurred in 2016. Guys, these people hate human beings. These are the same people who are trying to save you from your hands. They want you to abort your children. Why do you think that they'll care about you? Come on, guys. Wake up to this foolishness that's going on. So there's no tracker for murder. Murder is going on. And more than half of all murders in Jamaica go unresolved. Where are the contact tracers for the murders that are taking place? Guys, wake up to what they're doing to us. They're asking us to enslave ourselves. Now, this is an article here, September 5th. COVID everywhere. Health Ministry says virus can no longer be easily traced from one person to another. Why? Because it goes back to this. It goes back to this, guys. The Google Mobility Tracker. They're now going to be going after the various communities. See? Everything is down, so it's working. So whatever the government has in place is working. Recreation is down, groceries down, parks are down, workplaces are down. So people aren't going anywhere. They're staying home. So that is where they're going next in Jamaica. Okay? Where is it? It says Jamaicans can expect more COVID restrictions starting Monday. So Corona is going to chill out and wait until Monday to start doing stuff. So restrictions are going to start Monday as the country is now experiencing the community transmission phase of the pandemic. See? The community transmission phase of the pandemic. The declaration was made yesterday based on assessment from the technical team in the health ministry with representatives from the Pan-American Health Organization. This is the UN right here, guys. The Pan-American Health Organizations. These are the world leaders who worship Lucifer, going around the world, terrorizing the world population. In making this declaration, we are alerting the public that the transmission of the virus can no longer be easily traced from one member of the population to another. Everyone has it, guys. Everyone has it. They're coming. Everyone has it. He said that Jamaicans will now have to assume that everyone they come in contact with is positive. See? We're all viral. The population may see a steep rise in cases over the next 6 to 8 weeks, with a peak in cases around the end of September. See here, guys. So remember, as I said before, I'm not sure if I said it on this video because everyone I come in contact with, I try to let them know what's going on. The test that they're doing for corona is not a test for a virus that's somewhere in the air. They're testing for an immune response. Do a research on chromosome 8, guys. Chromosome 8 is the part of your DNA that tells your body how to respond to intrusions in the body. So pay attention to the skies over your head. That is how they spread respiratory infections. Those planes that fly over and put those chemicals in the air, the chemicals fall down as particulate matter. When people inhale it, it can cause a myriad of reactions in people, including respiratory inflammations, which will cause an immune response. And if you get tested, you will get tested. Some people, they may have an immune response and may not have, visible symptoms. But if you go and get tested, you will test positive, even though you're fine. You're more likely to be murdered in Jamaica than to die from corona. But they have locked down the whole country and the whole world around this thing. Why? Because they want to get rid of us. They want to be able to control your immune system. Tufton said new protocols will be introduced as early as Monday to help reduce the rate at which the virus spreads. Remember, people aren't going to work. People are, less people are going to school. How are they going to enforce this in people's homes? Pay attention to that. Tufton said the new protocols introduced Monday to help reduce spread. These new measures will include increase in curfew restrictions, right? So now you're in your yard, they want you to be in your house. Because remember, guys, we are the slaves. We are the slaves. They can campaign for months outside, running around, doing stuff. Elections is over, go to your yard. Because most of these people on these campaign trails, they're being fed. He noted that there will be an increase in stay-at-home orders for the elderly. Re-emphasis on the work-from-home orders, guys. Most people in rural outside of Kingston, Mobay, and Ocho Rios don't have internet at home. They don't have a computer. They're locking down schools. Schools in America are giving students computers and laptops and free Wi-Fi in neighborhoods and all of that stuff. Why aren't they doing that in Jamaica? You know why? Because they want to increase the disparity between the haves and the have-nots. And when they give the vaccines, they want to eliminate the have-nots. They want to be able to control your immune systems with artificial intelligence. They want to get rid of the poor. Next article here from Observer. The spread of COVID-19 in upper-class areas worrying, says Tufton. Guys, these people are the quote-unquote upper class. They are the upper class. They drive by these parties. They go to these parties. This is just fear-mongering, guys. This is nothing but fear-mongering. Okay? We won't even waste time reading. Let's just look in here real quick. Let's see what it says. He says, Uptown seems to be in some cases, particular in the corporate area, more affected now than downtown. Not to allow anyone to be complacent downtown, but it is quite obvious that the spread in certain parts of Uptown seems to be more concentrated. Right? Because remember Usain Bolt's party? He's a part of the elites now in Jamaica. The number of cases that are turning up in our hospitals with healthcare centers and with the spread of those numbers across the country means basically that COVID is out there everywhere and possibly could be affecting anyone. What this means is that the approach to managing will have to change to not allow the spread to overwhelm the public health system. Guys, Jamaica doesn't have a public health system. It doesn't have a public health system. And they have done nothing about that. Because why? they knew they were planning for something like this, where they could use fear mongering. That's trash. Let's move on. We already read this one. COVID is everywhere. They're saying that they can no longer easily trace it from person to person, so everyone has it, guys. Jamaicans can expect more restrictions Monday, right? We already read this one. Oops. Let's take a look at this thing right here.
21 medical professionals to boost the country's efforts against COVID-19. Health Minister Dr. Christopher Tufton provided details at a recent virtual press brief at the ministry's New Kingston offices.
We are well advanced with the employment and deployment of 121 medical officers. You would have recalled.
Okay. Let me go back here. Let's take a look at this news article here. This is a press briefing. Let's take a look.
The government will be engaging 121 medical professionals to boost the...
Okay. It's not a bad looking girl right here, guys, but good grief, what's wrong with her teeth?
Country's efforts against COVID-19. Health Minister Dr. Christopher Tufton provided details at a recent virtual press brief at the ministry's New Kingston offices.
New Kingston offices? Oh, they're in New Kingston. Gotcha.
We are.
What is this creature right here, guys? Is this a transgender? What is this? Is this a boy or this is a girl? I guess this is supposed to be a girl, but gosh. Now let's look at this fussy hole right here, so-called Tufton. Let's look at this sign right here they have right here. What kind of devil creature is this? What's going on? Let's pay attention to him. Look, he's a Freemason, right? They worship the Baphomet. They worship Lucifer, right? So you have to watch these guys. Anything that they say, think the opposite.
Well advanced with the employment and deployment of 121 medical officers. You would have recalled a discussion around those medical officers who did not have posts in the public health system. We have got...
So they had medical officers who were unemployed, is that what he was saying? During the pandemic? I thought they brought in doctors from Cuba and Mexico and China and wherever they could find them into the island to handle the COVID pandemic.
They go ahead to engage these persons, and I am told now that we will have contracts effective the 1st of September to engage these 121 medical officers. So in less than a week, those medical officers will be deployed, and that will bolster the numbers in the field and certainly assist as it relates to the COVID response.
Dr. Tufton said that along with the ongoing national recruitment drive of...
Okay, so see right here. So guys, remember, they tell us with the corona, it is to protect people. When you wear the mask, you wear the mask to protect others. So here he's speaking. He should have his mask on. He should have his muzzle on. And these dummies around him with their face diapers, they've all been infected now. They've all been infected now.
For community health aides, they will be creating a new post, which is that of the public health inspector.
In addition to that, we have 750 community health aides that are deployed. We're moving to the 1,000 mark, so recruitment is still on. Again, that will be a big addition to the cadre of workers in the field and will help us with the intelligence gathering and information flow, contact tracing, and so on.
Contact tracing. Okay, contact tracing. So guys, remember, he said that the community spread can no longer be traced from person to person, but they're employing contact tracers.
Beyond that, and I'm announcing this, I don't know if it's the first or second.
Take a look at this, guys. Take a look at this girl or boy. I don't know what it is. I think it's supposed to be a girl, I guess. But watch it. It's flashing all these devil signs. Watch it.
And will help us with the intelligence gathering and information flow, contact tracing, and so on. Beyond that, and I'm announcing.
What the? Beyond that, I'm announcing.
Information flow, contact tracing, and so on. Beyond that, and
beyond that. So the devil horns means beyond that? I thought that was supposed to be that devil worshipper's hand sign who came up with this language saying that sign should mean love or whatever it means. So devil horn means beyond that?
I'm announcing this, I don't know if it's the first or second time. I think I may have said it before. We're moving now to another category of public health workers that we are expanding, and that is our public health inspectors. And we're in the final stages.
Public health inspectors, guys. Public health inspectors. What are they going to be inspecting? Are they going into people's houses to inspect stuff?
The Office of the CMO working with the regions to determining a number of public health inspectors who will be engaged. And
engaged? What does it mean by engaged? Why does it keep saying engaged? I mean by what does engage mean?
The public health inspectors are very important to the process. They are at the local parish level. They go out in the field. They assess what is happening. And one of the primary reasons for engaging them is to provide leadership in terms of, the community health aides, to assist with that. Public health nurses do the same thing. But importantly, they will be used to drive the protocols that are in place to ensure that whether it's workplace, community, or otherwise, any protocol that is established around the response to COVID. Remember now we are about living with COVID, and so COVID is around.
Okay, living with COVID. So guys, so based on what he's saying here, this is what I understand is happening. The government is going to be employing inspectors to go around to businesses to make sure that they're following protocols. That's the same thing that they're doing in America and other countries, guys. This is a one world government agenda. So anything that you see him saying here or hear him saying here, that is what they're doing across the world as a part of their agenda. Because they're bringing in a Chinese form of government across the world. Whatever China was their experiment. So whatever China does to their people, that's what they want to do to everyone on this planet. Okay? So they're hiring inspectors to go to businesses. He's not saying that yet, because this is my first time watching this video. They'll be going to businesses and wherever and inspecting to make sure protocols are being followed. Make sure signs are up. Make sure this is that and that is that. Because remember, the sign of the pandemic has to be global. So that for future generations, they can say how bad it was. And how much worse it's going to be for future generations. If there is a future generation after these devil-inducing vaccines.
The numbers are reflecting that very clearly. Those public health inspectors will help to police, if you will, those protocols, support.
So they're giving the inspectors police powers.
Of course, by the rest of the team. So they are an important part of the response to COVID, the expansion of that cadre of workers. So in short order, we will make public the numbers and we will start that process.
So you see that, guys?
Effective September 1, the government will be...
So this one here is September 4th, guys. This one here I found interesting. And by the way, if you notice that the picture they posted of him, they posted this picture of him here for a reason. This right here is the Illuminati pyramid. This is the Illuminati pyramid. And you will see a lot of people, including Trump and all of those guys, do it. These people are all working together. At the top of all of this is the devil himself. It's the devil himself that they worship. They're carrying out the devil's agenda. These people have sold their soul for riches and for fame. Your elections don't count. How are elections conducted in Jamaica, guys? Think about it. Most of these elections now are done via machines. computers are counting them. Ask yourself this question. Who controls these machines? Who wrote the code, the program, to control these machines? Whoever wrote the code controls the machine. Think about that. So ask yourself this question. Who built the machine, the hardware? Who wrote the code, the software? Whoever controls that controls the machine. Jamaica's elections aren't controlled by Jamaicans. They're controlled by the world government. The same people who print our money, the same people who print our passports, the same people who put together the Bank of Jamaica, the same people who put together everything, the road system, all of that. They're the ones who control the elections. They determine who is in there to carry out their agenda. It's up to us to wake up to what's going on and to sound the alarm. Here, restrictions coming as Jamaica enters COVID community transmission phase. Now, they're saying here, the minister noted that over the next 6 to 8 weeks, the population may see a steep rise. So guys, they're already planning for a steep rise because they'll be spraying more chemicals in the air. Those planes that fly over and spray those chemicals, the government of Jamaica, through their radar network, they know who every person is that flies over the country. Who, once they enter Jamaica's airspace, they have to declare themselves, or it was previously declared, so they know who it is. Those people are flying over, putting those fake clouds in the air. So guys, whatever goes up must come down. So when they put those aerosol particles in the air, it is going to eventually fall to the ground. People are going to inhale those microscopic particles. It is going to trigger an immune response. And then when they test people for so-called COVID-19, they're testing for that immune response through chromosome 8, right? And if you test positive, guess what? You now have COVID-19. So it's so bad that nothing can save us. But the Lord himself, Lord Lucifer, and his vaccine will save us. The minister noted that over the next 6 to 8 weeks, the population may see a steep rise in COVID cases. He said more people are expected to seek medical attention in the public and private institutions. Tufton said this new phase of virus spread may mean more effective measures to reduce the spread of the virus to protect the vulnerable. He said health teams are currently examining protocols and will issue new protocols. The minister said measures will be introduced as early as Monday, and these measures will include curfew restrictions island-wide from 7 p.m. to 5 a.m. daily, stay-at-home orders for the elderly, re-emphasis on work-from-home orders, further tightening restrictions on public gatherings. So guys, these restrictions are coming right after their fake elections, guys. Use your brains. Use your brains. Don't be a dummy. Use your brain. Right? So that is all I have for today, guys. As news comes out and I feel moved to make a video, I'll make a new one. But remember, there is no pandemic. This is a plan for them to save us with their poisonous Luciferian vaccine as a part of their one world government agenda to depopulate the entire world. And guess what? Black people, poor black people, you are their primary target. God's people are their primary target. They want to eliminate us from this earth. Guys, be prepared. Be prepared. They're coming for us. The Luciferians are tightening the chains of enslavements around our necks. They're destroying the food. They're creating storms. They're interrupting the weather. They're spraying particles to make us sick. They're poisoning the water to make us sick. They're creating vaccines to give us cancer and other non-communicable diseases. They create fake communicable diseases and say they have to treat it. But they're after God's creation. They are after our immune system. Their sole purpose on this earth is to destroy God's people. Don't be complacent. Don't be complacent, guys. They are up to no good.